Are certain people, with thinner cartilages more at risk? Like, are women more at risk than men or
Yeah. So a lot of Caucasian patients have thinner cartilages. Well, it depends on which, demographic of Caucasians. But, ethnicity definitely will impact the strength of those cartilages, just in the same way that it impacts like the length of the nasal bones or so ethnicity plays a factor. Also the intrinsic structure of the actual nose. So the orientation of those cartilages will definitely impact how those nasal cartilages function and evolve over time. So patients that have cephalically oriented, so, pointing more upwards, the nasal cartilages will certainly develop external nasal valve collapse over time. So what you'll notice is their noses will start to droop and they'll develop kind of like this beak-like appearance to their nose as those cartilages weaken over time. So the orientation, the structure, ethnicity, I don't necessarily see a difference in gender, male versus female, but, anything that impacts, the strength of a cartilage or the shape, length, will always impact how that nasal cartilage evolves with time.
And I would imagine, are the presentations pretty similar between, like, if somebody has a really bad internal nasal valve collapse versus external nasal valve collapse? Is the main issue nasal obstruction and it's pretty similar, or are there certain nuances in the history?
I would say there's different nuances. Just strictly talk about internal nasal valves. When somebody comes in and they have internal nasal valve collapse, Ashley kind of alluded to this. They'll say things like, "I have to pull up on my cheeks to like get some air in. I have to sleep with breathe right strips. My nose feels like it's just I just can't get air through my nose, and I have to do these things structurally to improve it." That's really the skin of the cheeks are connected to those upper lateral cartilages, so anybody that says I have to pull up here on their cheek skin, it's a telltale sign that it's like an internal nasal valve issue. External nasal valve, people usually come in with a different kind of set of complaints. They'll say something like, I can breathe okay usually, but when I exercise, I can't breathe. And it's when I breathe harder through my nose, I can't breathe really well. Well, then you're like, okay, well, is it exercise induced like rhinitis? No, I don't get like any discharge or discomfort or congestion. It's like I can't breathe. Your nostrils pinch and they go, yeah, that's what happens. Like I can't, get the air through. And the quicker I breathe through my nose, my nostrils pinch down. So that's usually like a very strong telltale sign that the external valves are very weak. And when they're using their nose a lot, their nostrils are pinching. So that's usually the two different types of presentation.